Thousands of children and families in Marion County struggle with issues like poverty, substance abuse, or mental and emotional illness. Many local services exist to help families in crisis, but families often don't know about these services or can't get to them. Unmet needs can result in child abuse, neglect, or juvenile delinquency. The Early Intervention Planning Council, through the Marion County Commission on Youth's Early Intervention and Prevention Initiative, has created a plan to give families earlier access to services in the hopes of reducing the number of children who get abused or neglected or turn to delinquent acts. We hope you enjoy our monthly program, Our Kids, Our Families, Our Communities, and learn more about the local services here to help you.
Hello and welcome to Our Kids, Our Families, Our Communities, a show about preventing child abuse, neglect, and delinquency in our community. This month's show is going to focus on mental health awareness because May is Mental Health Awareness Month. So our guests today are from our community mental health centers. And I'm Shana Martin. I'm the director of the EIP initiative at McCoy, and we work with various programs and services focused on the positive development of youth to make sure that kids and families have the supports and services they need in our community. So I want to welcome our guests today, Jim and Dan, and I'll let them introduce themselves and tell us a little bit about what they do and who they work for.
I'm Jim Bush, Director of Clinical Decision Support and Business Development for Midtown Mental Health Center. Previously a child and adolescent therapist for about 20 years and then have been in administration since that time. And so I oversee some evidence-based practice, do some trainings and some business development pieces.
Okay, thank you.
My name is Dan Ahrens. I'm the Director of Business Development for Adult and Child Center here in Indianapolis. And I do mostly the grants, marketing, and any kind of new business opportunities that we want to pursue.
Okay, thank you very much, and thank you guys for being here today. So tell us a little bit about mental health, mental illness. You know, what is it? What does it look like? Because I think there's a lot of stigma, a lot of misconceptions about what mental health is and is not. So it'd be great for you guys to just give us some information, provide us with some facts and statistics about mental health.
I think you're right that there is a lot of stigma around mental illness, and I think one of the biggest myths out there is that mental illness is not as prevalent as it is.
Okay.
And in fact, about 1 in 5 Americans have a diagnosable mental illness at some point in their life. So it's pretty prevalent.
Okay.
And that number kind of expands from kids all the way to older adults. And I think mental illness has a huge impact on our society because it increases the prevalence of mental illness and substance abuse, causes people to miss work, visit the emergency rooms more often than they should. And really the mental health centers play a pivotal role in trying to treat that mental illness in the community as opposed to expensive hospital stays.
Okay, thank you.
I think another piece that's probably around the myths is this piece recently about them being more aggressive or violent. Mm-hmm. Typically people with mental disorders are about the same in terms of aggressive and violence as the general population. Okay. However, I think so some folks, about 6% of the population suffer from severe mental illness, and so they have active psychosis, so they might be hearing voices or seeing things, feeling like folks are out to get them, and so those circumstances when they're feeling symptomatic that they may, be in a position where that they might not feel safe, and those kinds of things. But generally, people also have, what we call mood disorders, which would be very different from severe mental illness, which would be more reaction to circumstances in life. So there would be, I think, 29% have anxiety disorders of the folks that have mental illness issues. And then impulse control disorders would be at about 25%, and then substance abuse about 15%. And so those are some mood disorders that we would see that would be really separate from the severe mental illness.
Okay.
And so some of it's more brain and organic. So the severe mental illness would really be primarily an organic brain dysfunction in terms of bipolar disorder or schizophrenia. Where I think the recent times with all the challenges and stresses in the world that we also see anxiety and depression based on the economy, being able to keep jobs, managing stress, the things that we see in the media all day long in terms of catastrophes and managing that. So I think not only is it prevalent, but I think it's probably increased recently in terms of just all the stresses that people are facing.
Okay. So that's really good to learn that in some cases mental health issues are things that we, like you said, brain and organically that we don't have control over. It's chemical, and so it's really imperative that you seek treatment and receive assistance for that. And the other can be triggered by things that happen in life, things that we don't have, again, control over. Some traumatic experiences, just losing your job, being overly stressed. That again, in some cases, people don't just wake up and come out of. That they need some support for that, need to seek treatment, counseling, sometimes medication, and that when that doesn't happen, then it impacts other people around them, particularly as a parent, that it impacts your kids. Right. If you're not, functioning optimally, if you're not getting enough sleep, if you're overly worried or anxious, then that impedes your ability to be able to parent your children well, which we know can have negative consequences for the kids as well.
Absolutely.
I believe one of the other myths that our society needs to work on is the myth that mental health is not treatable or it's not curable. I read some recent statistics that show the mental health recovery rate, the success rate for people who suffer from even bipolar schizophrenia and depression and that kind of thing. The rates of success are better or equal to that of diabetes, heart disease, cardiovascular disease.
Okay.
And I think our society spends a lot of time treating diabetes, and when people are diagnosed with diabetes, they're not necessarily negatively impacted by that. They're not stigmatized by that. Whereas somebody with depression or anxiety may feel more stigmatized and may feel like there's less hope for them, when statistics show they have a better success rate curing or recovering from depression than somebody with diabetes, for example.
Okay. Good. So you're kind of, you guys have both sort of put a face on this, that this happens to lots of people, and that folks can overcome it. Again, but if you think that you can do it by yourself or at home, just like other diseases, that's not the case. And so there are resources available, there's help out there, but people have to be okay with being able to ask that and recognizing that there may be people that they work with every day that they see on the streets that are also struggling with some of the same issues, and it's really okay.
Right.
And it's okay to ask for help.
Yeah.
Okay, so thank you. Tell me a little bit about addictions. Addictions was mentioned. Tell me about that, because I know that substance abuse, particularly when we work with kids in the child welfare system and the delinquency system, we see a lot of parents that have addiction or substance abuse issues, and are starting to see it a little bit more in the kids as well. So tell us a little bit about what role that plays and when we talk about mental illness or mental health.
I think addictions does play a significant role, or can play a significant role, primarily because people who experience addictions make decisions that they wouldn't necessarily make if they were quote-unquote clean. And that bleeds into parenting, it bleeds into showing up for work. And I think the verdict is still out whether the whole nature versus nurture kind of concept. Do people with addictions catch mental illness? Not typically. Typically it's the other way around, that people with mental illness kind of self-medicate with prescription or illegal drugs, and it leads to an addiction.
And the smoking rate is extremely high, the tobacco use rate is very high, and that's very concerning because folks with severe mental illness tend to die about 25 years earlier than the general population. A huge portion of that is the smoking piece. Okay. Some of it is that they get sedentary and that they are not out and about and exercising as much. Some of that can be side effects of medications, but I think that's a big concern. Also, I think a big piece to that is that trauma, that we see a lot of children experiencing trauma, and the way they begin to cope is to begin to use things that numb the pain, that deal with that. And so we see a direct correlation with folks with a lot of trauma end up lifelong without education, intervention, and treatment, really with some substance abuse challenges. And so what we're trying to do is identify youth that have had adverse childhood experiences, and try and help educate and prevent the long-term effects of what that leads to. Okay. Also trying to work with our folks that are suffering and struggling with substance abuse, that looking at making sure that we're treating the trauma that could have caused and been the core to some of these issues. Okay. I think it's a pretty exciting time in terms of what the brain research is finding about addictions, about trauma, about how to repair things. This plasticity is something that's being discussed lately, where we once thought that really brain cells didn't rejuvenate. Now we're seeing that really we can regenerate and recreate a new kind of environment in our brain that's more resilient, that does, that is able to kind of be treated and make new pathways to successful ways of doing things. So I think there's a lot of very exciting things on that front. About 60% of the folks that we treat, we have about 8,000 folks that are diagnosed with a severe mental illness, and about 60% of those also have a diagnosable substance abuse disorder.
Okay.
It's also something that tends to lead to, we've been trying to look at statistics when folks do end up in the emergency room, either trying to hurt themselves, hurt somebody else, end up in a physical situation. Many times it's related to using substances.
Okay.
So I think we need to get to the core of it. We need to be able to treat it. And like we were saying about the diabetes, we need to expect some failure, that this is not going to be treated the first time and work, that we're going to treat it over time. It's a chronic brain disease that really needs ongoing treatment over time, but that we do have success. We have a substantial amount of success, but we have to kind of continue to have hope and to encourage and to be positive and not be judgmental, and the stigma is still very prevalent.
Okay. So that's another good thing to point out, that if you're a family member struggling with a family member who has a substance abuse issue or addiction, that it is a process, and it does take a while, and it takes a lot of support and patience, and it's kind of hard to remember that when you're on the receiving end of sometimes of that person and what they're going through, which involves sometimes lying and stealing and mistreating people, and that that a lot of that stems from trauma, and not addressing the trauma then is just going to allow the substance abuse to continue to come up, because what they're doing is trying to, like you said, numb the pain, and if the pain is not dealt with or addressed, then they're going to continue to find ways to cope with that in unhealthy ways. So, well, thank you. Very enlightening. Lots of really good information. So tell us a little bit more about your organization, your mental health center, how people get to you, what services you provide, and any other specific information that the folks who are watching this show would need to know.
Adult and Child Center is a community mental health center, state certified and JCO accredited. We've been around since the mid-40s. We really provide services to three major populations. One is the serious mentally ill adults. Two is the integrated care, which blends the medical care, primary care, the care for like diabetes, with the care of behavioral health.
Okay.
So kind of a one-stop shop. And then the third big population we serve is the child welfare, people who are caught up in the child welfare system or foster care system. The best way to contact us would be to call our telephone numbers, 317-882-5122, or our website is www.adultandchild.org.
Thank you.
Yep.
Jim?
So we are affiliated, Midtown Mental Health Center is affiliated with Wishart Hospital. So we do have an inpatient unit on in the hospital, as well as a crisis respite unit. We generally serve folks in Marion County for the most part. We serve about 8,000 folks each year that have severe mental illness for adults. We serve about 1,200 youth around the city. We're in 23 IPS schools. Okay. We have a team at the detention center. We have a home-based home builders and a home-based team, and a general outpatient office for children. So let's see. We also have wraparound services, the CAPRTF, which is actually in the Adult and Child Center, that really provides.
CAPRTF stands for?
Community Alternatives to Psychiatric Residential Treatment Facilities.
Okay, thank you.
Which is really folks with high needs that need kind of that. Actually, our folks, both of our folks, will work in facilitating the services that they need to try and keep children in the home when they're facing placement or out-of-home placement or dissolution of the family. So some really intense services. We also work a lot with the homeless population. We work at the Horizon House, and so for folks that are homeless or struggling with homelessness, we also have group homes and cluster apartments. But really, one of the direct feeds, they can just go directly to the Horizon House and can begin connect with services there. In terms of access, we have one access line. 630-7791 to get access to services to schedule an appointment. Or we have a 24-hour crisis hotline, which is 630-8485, and that can give you access to services as well. But those are the primary hubs that we utilize. We also do have a West Side office in Speedway that does treat some mood disorders, borderline personality disorder, and there's a supportive employment program over there. And we have 2 ACT teams, assertive community treatment teams for folks with the highest needs.
All right. Well, thank you very much, gentlemen. Really appreciate you being here and sharing all of this information. And folks who are watching, please stay tuned. We've got some more information about mental health coming in the next segment. Thank you. Okay, welcome back to the second segment of our Kids, Our Families, Our Communities. And we have some new guests joining us to talk more about mental health and mental illness, as May is Mental Health Awareness Month. So I'm going to let you ladies introduce yourselves. We have Joan.
I am Joan Reed. I'm Operations Director for the Gallahue Community Health Network school-based program.
Okay, and Jody.
I'm Jody Horseman. I am the Senior Director of Youth and Family Community Services for Aspire, Indiana.
Okay, so you guys were in the, around when you heard the other 2 gentlemen talk a little bit about mental health, generally speaking, and some information about addictions. Is there anything in particular that you would like to add or to share a little bit more information about?
I think they did a pretty good job.
Yeah,
they did a pretty good job covering
it.
it.
One thing I'd like to add is that I think sometimes it's hard for people to realize that someone might be suffering from a mental illness because you can't see it always. If someone has a broken leg or something like that, you can see it because it's physically there. And so I think it's a little harder to be tuned into that because you can't always see it.
Okay.
That's a good point with kids, especially. A lot of times you'll see the behavioral aspects of that, and so people will kind of make assumptions about that child based on their behavior, when really that behavior is kind of an acting out symptom of what's going on inside, because they don't have the verbal ability or cognitive ability to just kind of lay out what's really going on with them.
Okay. And I think kind of what came out in the first segment is that mental illness can touch anybody, that there is not a certain kind of person you're going to look at or a certain race or ethnicity or cultural background, that mental illness can be something that's a part of the brain or can be caused by stress in life, so it could affect any of us. So I think you bring up a good point that it's often hard to know when somebody is really just having a bad day or having a series of bad days that may be leading to something else. So just being tuned in to the folks who are around you and being willing to kind of ask the questions and say, are you okay, or what's going on, or give them some support and resources. So tell us a little bit about negative childhood experiences and more about trauma. We touched on it a little bit, but how does what happens and what a child experiences, particularly if it's negative, potentially look like as they grow up?
I'm going to answer that from both sides.
Okay.
So, obviously development is a lifelong process, and a lot of things happen, early childhood, and the brain's continuing to develop until about age 25.
Okay.
And we know that experiences that we have when we're younger, especially very intense experiences, do have an impact in the way that the brain develops. That's positive and negative. Okay. So one of the things I wanted to point out is that you hear a lot about trauma, especially now. You have the Boston Marathon. People are really focused on that. And I want to differentiate stressful from traumatic. Okay, because we all experience stressful events. That's part of growing, that's part of developing, that's part of learning, how to cope with the world. So, and so we build resilience along the way by experiencing obstacles, experiencing things that go badly for us, and learning ways to cope with that. To differentiate, trauma is an event. It could be a single event, or it could be a chronic series of events that really are just kind of overwhelming to somebody's ability to cope with that. So it kind of washes over, and so they're unable to use any of the resources that they might be able to use to deal with that, and that does have an impact on people. I think at that point in time, then anything that we've learned in terms of resiliency, the things that we normally would refer back to, if that doesn't kind of step up to the point that we can deal with this, then we can say it's a traumatic event.
Okay.
For kids especially, kids focus on the people in their environment.
Mm-hmm.
So when a traumatic event involves those people in their environment, so it could be an abuse or neglect situation, it could be the loss of a parent, it can be, it can be a divorce. And what's experienced as trauma can be different for different people.
Yeah.
So that's one thing, is like, you can't say, oh, that's not traumatic for that person, because it may be. It does have an impact, and can have a lifelong impact depending on how a person is able to deal with it and what resources they bring to bear. So what we oftentimes see in kids that don't recover well or carry that on into adulthood is that they were unable to bring those resources to bear, or that they didn't have the abilities or the people surrounding them to give them that safe place.
Okay.
So it interferes with their ability to attach.
Okay.
And especially if the trauma involves a parent or that person that is supposed to be the caretaker, that you're supposed to go to for that support and safety, then that really impairs that attachment. And so people look for other ways to deal with that level of emotion, that level of impact, and sometimes those aren't very adaptive ways.
Okay.
So that can be, and they touched on it in the previous, it could be in the previous segment, it could be turning to substance abuse to kind of numb that or suppress it. It could be maladaptive relationships, entering into relationships where you're kind of repeating that pattern over and over. It can be really re-experiencing at a very high level of intensity some of the same triggers or responses that trauma brought about, not knowing what to do with that, and so having these reactions that other people are really kind of misperceiving.
Okay.
But part of that is that there's some real resiliency factors that can be built in as well. That who is the person that child can turn to? Is it a parent or a caretaker? Is it the teacher at the school? Are people aware? Are they paying attention to what's going on for that youth? And are they willing to ask those questions? Asking a child a question about, hey, you seem like you're not feeling real well today. Or even asking somebody if they've ever thought about hurting themselves. A lot of people are afraid, I don't bring it up, because if I bring it up, then that's going to put it in their head. No, that's not the case. If those thoughts are there,
they're there.
Let's elicit that. Let's bring those out. So part of that is a real opportunity for building that resiliency. Is to wrap those supports not just in a family but in the community, in a workplace, making people more aware that this is a part of a continuum of what happens to people in their lifetime. So let's be aware of it. Let's build in the supports for those people and help them recover from that and develop those really adaptive behaviors and get on with the potential of their life.
Okay, and when you say resiliency, because you use that word several times, what do you mean by that? Define resiliency.
Resiliency is, in my terms, I would say, it's a set of beliefs, attitudes, behaviors that allow people to kind of spring back.
Okay.
Okay, to either a previous level of functioning, or that they can bring to bear on a new situation, new stressful situation, that allows them to cope with it in an adaptive way. For example, we know that kids that are taught some abilities to deal with conflict and have some more positive self-esteem are not as highly impacted by bullying in school. So that's resiliency, and so it can be built and then used to prevent negative reactions to stressful or traumatic events.
Okay. So what role, Joan, do parents and schools play in working with kids in particular that may have experienced trauma, may be struggling with their resiliency factors? I mean, what role do these other folks play?
Well, I think Jody mentioned the word awareness, and I think that's the most important thing for parents and teachers, to be aware of what is kind of the norm for their child or their student, and to look for things that may be impacting in a different way their attitudes and behaviors, that something's not quite right there, talk to your child, listen to your child, and just be aware when changes take place. The best thing a parent can do is be a good positive role model to handle frustration and anger, to let them know that there's a better way to do it than to turn to violence, and just be a good role model in that aspect. If they're in treatment and medication is required, whether it's depression, anxiety, or whatever the situation might be, it's important for parents to see that they take it on a regular basis, so that they can be as successful as possible.
Okay, thank you. So tell us a little bit about the services that you guys offer, in particular at each one of your community mental health centers.
Well, we offer a full continuum of services. We have services in Madison, Hancock, Shelbyville, and several offices in Marion County. We have an inpatient hospitalization program at our community psychiatric pavilion, which is located close to our North Campus for community. We also have home-based. We have DCS team. We have CAPRTF, as Jim had mentioned.
Okay.
We have a huge school-based program, which I'm very proud of. We have about 65 staff, 85 staff in about 65 schools.
Okay.
We have therapists there who provide services in the schools. So we try to reach the children when they're young and do some education and prevention, and hoping that we can get some of those issues under control before they become adults. We have a addictions program,
okay.
And we also have residential and group homes as well for youth and for adults. So it's a pretty wide continuum of services that we offer.
Okay, and I think it's really important to highlight the fact that you are as Gallahue in a lot of the schools, because if a parent is struggling with a child or is just not sure, feels like something is going on, then a school is a really good place for them to use as a kind of a first point of contact and a resource. So they can always call their school counselor or school social worker to say, is there a community mental health center that is working with the school, and how do I get connected or in contact? I have some concerns, and that's a great resource.
And to try to get that parent involved, to come to school and talk about some of the issues, and have good communication between the parents and the school. That's a really, really important piece.
The parents have to be involved, and I think we talked about that in our last show, and we'll talk about that in every show, that parents have to be involved and engaged. They have to be good role models, and they have to try to prevent kids from being traumatized as much as possible, at least within the boundaries and the areas that they can within the home.